I'm Dr. Beth Kasanoff-Piper, President of the Dallas County Medical Society. What do we know right now about the state of COVID? The Delta variant is still the predominant variant in the United States currently, but the number of Omicron cases are doubling rapidly, about every 1.5 to 3 days. Omicron is expected to be the dominant strain in the United States within the next few weeks. Having had 2 COVID vaccines provides about 40% protection against severe illness or death from the Omicron variant, but the addition of a booster increases that protection to about 80%. While at this time it appears the Omicron variant may not be more severe than Delta, it is significantly more transmissible, which means there will be a lot more people infected, so that the overall numbers of patients who will need emergency, hospital, or ICU care will dramatically increase in the coming weeks, leading to more strain on our overly burdened hospital systems. New York State reached its highest new case count of the entire pandemic on Friday, as did Washington, D.C. Scientists are predicting a big surge in much of the country over the next 1 to 2 weeks. If you are not vaccinated, please start your vaccine series. If you're vaccinated but not boosted, please get your booster. If you have any symptoms, runny nose, sore throat, headache, chills, cough, anything that is new, don't just assume it's allergies or a cold. Please isolate yourself until you can get tested so that you don't spread it to other people. You may have heard people saying, well, everybody is going to get this. Let's just all get it and get it over with. But here's the problem with that plan. The more cases of COVID that occur, the more chance of mutations into a variant that's even more severe or that can escape our vaccines or our therapeutics. Hospitals will be overwhelmed with the unvaccinated COVID patients, leaving no room for people who have heart attacks or accidents or other health problems and need emergency care. Plus, if we can slow the spread of this virus, we can have more time to create even better vaccines, and the long-term symptoms from COVID could be prevented by avoiding the disease altogether. The CDC just published a study looking at whether physician recommendation to get a COVID vaccine had any impact. About half of the study respondents were not given any recommendation to vaccinate from their doctors, and this was an even higher number in some rural areas. But adults who had received a recommendation to get the vaccine were about 16% more likely to have received at least one shot than those who didn't. So please keep recommending the vaccines to your patients and to your family members. It makes a difference. And please be careful this holiday season. Wear your masks, do as much as you can outside, and try to avoid situations that are risky. We all want to be with family, and we all want to spend more time with the people we love, but let's do it as carefully as we can. Thank you.